Are retinols and maybe other cosmetics causing your eyes to be red? I was asked specifically about retinols. Can retinols make your eyes dry and red? Why are your eyes dry and red? It may not just be the retinol, might be other things. But more importantly, is there anything you can do? Today, I'm going to help you. I'm going to give you a list of the top culprits for eye irritation, redness, sensitivity. It's so common. Often what's irritating the eyes are the most popular practices for beauty, lashes, and skin. So please don't be upset with me for giving you these. I do have some solutions and we can work through this, so stay tuned. Often we can eliminate or reduce the causes, so that is the good news. We'll do something about it. If you like these videos, click like and subscribe so you won't miss one of them. I bring you many things for health, beauty, fashion, including supplements and things that you can do at home. OSD, or ocular surface disease. It refers to the blanket condition covering many ailments that can hamper your tear film and dry out the ocular surface. Patients presenting with ocular surface disease represent a significant portion of the ophthalmologist's practice. OSD is often undiagnosed and insufficiently treated. Often, unfortunately, it is from makeup and beauty creams. The very things we seek to enhance our beauty and our looks, not diminish them, and we use to contrast portions of our face, such as the eye, the brow, the lashes, and that's what's important about this video. As we dive into this, first keep in mind the cosmetics industry is unregulated by the FDA, and many of the ingredients not even listed on a product can significantly impact ocular surface disease. For instance, take Latisse. It's a drug, it's regulated, whereas lash conditioners, they're unregulated but may contain some of the same ingredients or preservatives that are in Latisse. Here are some of the top products to look for. Number one, waterproof eyeliner or mascara. They are waterproof for a reason. They're hard to remove and filled with irritants. Only eye makeup remover containing harsh chemicals can actually dissolve the residues that these produce and leave around the eyes. Patients who wear these products either expose their eyes to harsh chemicals or fail to completely remove the potential irritants before they go to bed. Sparkly eyeshadows. Mica and other minerals can cause redness and irritation, while glitter can even flake off, of course cause irritation, but sometimes it actually gets into the eye and needs to be removed. But even regular old makeup can cause problems. The key word being old. Makeup that's past its use by date can become a breeding ground for bacteria and fungus. The expiration date depends on the formula, but most experts recommend tossing products after 3 months to about a year. Dry products, of course, are going to last a little longer because lotions or creamy products, they have moisture and water, and things grow and divide quicker amongst moisture. Keep in mind, if contaminated, even 1 week is still old, so you have to keep it clean, and when you're transferring or applying it, use new Q-tips. Be mindful where the application method is. So just because something's new, it can still become contaminated. What are some of the bad ingredients that you're going to look for in your eyeshadow? There's a top number, and they include parabens, ethyl oxalated ingredients such as PEGs like polyethylene glycol, polysorbate. What about carbon black, paraffin wax, isoparaffin liquid, polyacrylamide, talc, PTFE, or Teflon? Next on our list is eyelash growth serums. Oh, so popular. These serums contain isopropyl cloprestinate and other prostaglandin analogs. Potential side effects of these type of drugs include lid and ocular surface inflammation, which causes red eye, and orbital fat atrophy. That is premature aging of the eye, and it's scaring a lot of people. I'm doing a complete video on that, so look for that video on how these can age your eye. We need to do a complete section on that. But as for eye irritation, they can certainly cause it. These are both sold over the counter and by prescription. Over the counter products usually contain other ingredients such as peptides, biotin, cloprostinate, as I mentioned. The only FDA actually approved prescription option for eyelash growth is Latisse, and that contains bimatoprost. Ingredients that release formaldehyde. Now this is the next category, and formaldehyde irritates the ocular surface. When you read the list of cosmetic ingredients, unfortunately, you're not going to see formaldehyde listed. But you are going to see names such as DMDM, hydantoin, ureas, sodium hydroxymethylglycinate. These ingredients are related to formaldehyde, and we know that formaldehyde obviously irritates the eye and the cornea even at very low concentrations of 0.05 parts per million. So look for those. Next on the list is retin-A and retinol derivatives. Retinoids such as retinol, which is found in a lot of anti-aging lotions, under eye creams, they can cause the Meibomian gland to be damaged. So that's along the lash, the eyelash at the lid margin, you find these glands. They're responsible for lubricating the eye, and they're so important. They haven't been shown to cause the fat atrophy that we talked about with the conditioners, but they have been shown to irritate the eye. Dry eye patients can stop using these derivatives on the face, the entire face, because remember, might get on your pillow, might then inadvertently get in the eye, so it's not just eye creams. But stop them for about 4 weeks, see if things improve. If patients stop using them around their eyes and the dry eye gets better, then we know. It's really the only way to test this. Makeup application techniques and cosmetic procedures can also be problematic. A few examples are tightening. What's this? It's that technique in which you line the upper waterline to enhance your eyes and create a fuller, the wide-eyed look that is so in. So if you're using something for a wide-eyed look, you might be using that type of technique. By placing that eyeliner right into the lash line of your top lashes, you tight line the eyes and create that illusion, it's all an illusion, of dense lash roots. So be mindful of that practice. It definitely irritates the eye because you're right there where those important glands are. Lash extensions. Almost everyone I see has something to grow the lashes. If it's not the conditioner, it's the extensions, and they can be very long. Lash salons typically recommend that the patients keep water away from their eyes during the first 12 to 24 hours after the application. That is so that the glue can dry and set properly. Firstly, women who spend hundreds of hours and $200 or more in a lash salon may just stop cleaning their lashes altogether because they want them to last longer. Big mistake. Altering the lash length has other insidious effects for the patients with red eye. It changes, imagine this, the lid lash ratio, so that the normal length lashes, of course they usually do something. Eyelashes, many people don't even think about this, but they have a physiologic function for the eye. So it's very important for their function to deflect wind. That's just one of them. Also debris and allergens, and keep those away from the surface. When you start to artificially adjust the ratio, and I'm targeting lash extensions here because usually they're growing the lashes longer than with conditioners or Latisse. When you create that wind tunnel effect, the wind is changed and the protection is changed around the surface of the eye. So instead of moving debris and wind away, it actually creates a funnel that actually allows particles, allergens, and actually wind flow to get into the eye. The exact opposite of what you want to do for a healthy eye surface. So be mindful of that. Now, of course, eyelid tattooing, very common. Folks who don't want to bother applying eye makeup every other day, they get a permanent eyeliner, and this can significantly affect the eye line and give you keratitis and lid trauma. What about Botox? A lot of people are tired of getting crow's feet. They want solutions. They want instant. Botox can do this in a couple ways. Botox works by weakening that muscle, the orbicularis oculi muscle that shuts the eye. And when you get an incomplete blink, that can worsen dry eye. The other thing is, we could create a more open eye look by injecting toxin below the lower lid. It gives a more wide open blank stare. That certainly causes dry eye. I've seen many cases of that. Some people just live with it because they want a wider open eye, but inadvertently some people might not realize their Botox can certainly cause dry eye. So eye hygiene is very important, and those are some causative agents. That's the first thing, to eliminate everything. Start things back one at a time. See what's irritating your eye. We did talk about meibomian glands, and there's several things that people can do for the health of the eye to help produce more fluid, to keep the eye functioning. It's way more complex than people think in terms of the airflow to the eye, the production of the fluid, and then the fluid draining from the medial or the intersection of the eye. That all has to function perfectly. There are many things people can do, such as warm compresses, milking the meibomian gland, drops that are preservative free. If you'd like a video more in depth of what to do for those things, click the like button and tell me in the comments below. A nighttime routine is absolutely key to a healthy eye. But start by removing those. Tell me, what do you do to help keep your eyes perfect, moist, white, and of course, vision is the most important part. I put a complete playlist up here on retinols, retinoids, and one down here on bakuchiol. It's a non-retinoid, but it actually works like a retinol and it causes less irritation. Stay tuned, keep your skin and body beautiful, healthy, and vibrant.